I need you to stop scrolling right now. What I'm about to share with you in the next few minutes could genuinely be the most clinically important conversation you have about your health this entire year. And I'm not saying that to grab your attention. I'm saying it because I spent the last 22 years as a molecular oncologist watching patients in their 50s, 60s, and 70s fight cancers that the current evidence tells us were almost entirely preventable. Not with drugs, not with surgery, but with 5 specific daily habits that most physicians, including many of my own colleagues, never discuss in the exam room. My name is Dr. Michael Kent. I'm a molecular oncologist, a preventive medicine researcher, and the author of 2 books on cellular aging and disease prevention. And today, I'm going to break down the 5 most powerful evidence-based habits for cancer risk reduction in adults over 50. Ranked from meaningful to absolutely transformational, because the order here is not arbitrary. Each one of these habits works on a different biological pathway, and when you combine them, the compounding effect is something the research describes as clinically extraordinary. Now, I want to plant something in your mind right now before we get into the list. Number 1 on this list, and the single most powerful thing you can do for cancer prevention after 50X, is something that almost no one over 65 is doing with any consistency. And a landmark study out of the University of California, San Diego, tracking adults for over 20 years, found that correcting this one thing alone was associated with a reduction in cancer mortality of up to 52%. I'll give you everything you need to implement it by the end of this video, so do not jump ahead. Watch this all the way through because each habit we cover genuinely amplifies the one after it. Before we get into number 5, I want to ask you something personal. Leave a comment below right now. Tell me your age and answer this. Have you ever had a physician sit down with you and specifically discuss what you can do today to prevent cancer, not just detect it? I read every comment on this channel, and the answers I get shape everything I create here. Take 10 seconds. It matters. Let's get into it, starting at number 5. Number 5 is something so fundamental to human biology that our ancestors did it automatically every single day without thinking about it. And yet a 2023 analysis from the National Cancer Institute found that over 70% of adults over the age of 60 are chronically deficient in the compound this habit produces. A compound that, when present at optimal levels, has been shown to reduce the risk of colorectal, breast, and prostate cancer by measurable and significant margins. I'm talking about morning sunlight exposure. Specifically, 10 to 15 minutes of direct, unfiltered morning sunlight on your bare skin. Arms, face, the backs of your hands within the first 60 to 90 minutes of waking. Before sunscreen, before glass, and before your body is in full shade. Here's the mechanism, and this is where it gets genuinely important for aging biology. Your skin contains a cholesterol compound called 7-dehydrocholesterol. When UVB light from the sun strikes this compound, it triggers a 2-step conversion, first in your liver, then in your kidneys, that produces the active form of vitamin D, a compound that functions less like a vitamin and more like a master hormone. Over 200 genes in your body respond directly to vitamin D signaling. Several of those genes are tumor suppressor genes, genes whose entire job is to detect damaged cells and halt their replication before they can mutate into cancer. After the age of 60, your skin's ability to synthesize vitamin D from sunlight declines by approximately 25%. After 70, that efficiency drops by nearly 50%. This is not a minor detail. This is your primary natural tumor suppressor system running at half capacity, and most people don't know it's happening. The VITAL trial, conducted by researchers at Brigham and Women's Hospital and Harvard Medical School, followed over 25,000 adults for 5 years and found that adults with optimal vitamin D levels had a 17% reduction in cancer mortality overall. And in the follow-up period, that mortality reduction rose to 25%. Not incidence, mortality. The cancer was less likely to kill them. Think about what that means at the cellular level. Vitamin D doesn't just reduce the chances of cancer developing, it changes the biological environment in which cancer tries to grow, making it harder for tumors to become fatal. But here's the detail most people miss entirely. Supplementation alone does not replicate what morning sunlight does. Because morning light, specifically in the 480 nanometer blue range, also triggers your suprachiasmatic nucleus, the master clock of your circadian system, which directly governs the timing and intensity of your immune surveillance activity. Your natural killer cells, the frontline immune cells whose specific function is to identify and destroy cancer cells before they establish, are regulated in a 24-hour cycle anchored by that first morning light signal. When that signal is absent, when you wake up and go straight to a screen in a dim room, your NK cell activity peaks at the wrong time of day, collides with sleep cycles, and loses 30 to 40% of its daily effectiveness. The prescription for this habit is simple. Set your alarm 10 minutes earlier. Walk outside within 90 minutes of waking. Stand in direct sunlight, no glass, no SPF, for 10 to 15 minutes. Face any direction. Let the light hit your skin. If your weather doesn't cooperate 3 to 4 days a week, talk to your physician about vitamin D3 plus K2 supplementation. Because K2 is what ensures the D3 you absorb gets directed to soft tissue rather than calcifying in your arteries. Your synergy tip for this habit: pair your morning sunlight with your body in motion, even a 5-minute walk. Light plus movement produces a cortisol awakening response, a controlled, brief spike in cortisol that primes your immune system for the entire day. Together, these two signals create what researchers at the University of Michigan call an immune launch sequence. Separately, each is good. Together, they are measurably better. That's number 5. But what you do with your eating window starting this week could have an even more profound impact on the cellular machinery that either feeds or starves cancer. That's number 4. Number 4 involves not what you eat, but when you eat. And the biological reason this matters so profoundly for cancer prevention after 50 is one of the most compelling pieces of science I've encountered in 2 decades of research. I'm talking about time-restricted eating. Specifically, condensing your daily food intake into a window of 8 to 10 hours and allowing your body to fast for the remaining 14 to 16 hours overnight and into the morning. Here's why this is so critical for aging biology. One of your body's most powerful anti-cancer mechanisms is a cellular self-cleaning process called autophagy. Autophagy, from the Greek for self-eating, is the process by which your cells identify their own damaged, dysfunctional, and precancerous components and systematically break them down and recycle them before those components can trigger malignant transformation. Think of autophagy like a sanitation crew that works the overnight shift inside every single cell in your body, identifying and removing damaged materials before the morning shift. Cellular replication begins. If the sanitation crew doesn't finish before replication starts, damaged material gets copied. Copied damage is how cancer begins. The problem is this: autophagy only activates in the absence of insulin. The moment you eat anything, including a small snack, insulin rises and autophagy shuts off completely. For adults who graze across 14 to 16 hours of the day, their cells may be running autophagy for only 6 to 8 hours overnight. In the research of Dr. Walter Longo at the USC Longevity Institute, adults who consistently maintain a 14-plus hour fasting window show measurably deeper autophagy activation, lower levels of IGF-1, a growth hormone that, when chronically elevated, acts like fertilizer for tumor cells, and a 40% reduction in circulating inflammatory markers compared to those eating across 16 or more hours per day. After the age of 60, autophagy efficiency already declines by approximately 35% due to aging alone. Combining that natural decline with a perpetually shortened fasting window means your cellular sanitation crew is operating at maybe 40% capacity. And every morning, your body begins a new cycle of cell division with the previous day's cellular debris still sitting there unaddressed. I want to tell you about David. David was 63 years old, a retired engineer from Austin, Texas, who came to my clinic following a diagnosis of metabolic syndrome and elevated PSA, a prostate marker that had been climbing for 2 years. He was an early riser, breakfast at 6 a.m. and dinner at 8:30 p.m., a 16-hour eating window every day. He had never heard of time-restricted eating. We shifted his window to 9 a.m. to 6 p.m. Nothing else changed in his diet initially. Within 4 months, his fasting insulin had dropped by 34%, his IGF-1 came down into optimal range, and at his 6-month follow-up, his PSA had stabilized for the first time in 3 years. His urologist asked him what he'd done differently. He told me he felt like he had handed his body a biological reset switch. He was right. To implement this correctly, stop eating at least 3 hours before bed. Start your first meal no earlier than 12 to 14 hours after your last meal the previous evening. Black coffee and plain water do not break a fast. And here is the aging-specific detail that matters. For adults over 65, begin with a 12-hour window and extend gradually because aggressive fasting without adequate protein timing can accelerate muscle loss, a risk that compounds with age. Work with your physician to calibrate this for your body. Synergy tip: pair your fasting window with your morning sunlight from Habit 5. Fasted morning movement combined with light exposure maximizes your morning cortisol awakening response and extends your autophagy window by 1 to 2 additional hours past waking. 2 habits, compounded effect. Number 4 is powerful, but number 3 is where the science becomes genuinely extraordinary, because it reveals a type of physical activity that does something no drug in oncology has ever been able to replicate. Let's get into it. Number 3 is something almost everyone over 60 is avoiding, either because they think it's too intense for their age or because no one has explained what happens inside their body when they do it. And that avoidance, the research now suggests, is one of the most significant missed opportunities in cancer prevention medicine today. I'm talking about resistance training, specifically 2 to 3 sessions per week of body weight or weight-bearing exercise that challenges your muscles to the point of moderate fatigue. This is not about bodybuilding. This is not about the gym. This is about triggering a cascade of molecular signals from your muscle tissue that your body literally cannot produce any other way. When a muscle fiber undergoes mechanical stress, it releases a class of signaling molecules called myokines. Think of myokines like a field dispatch from your muscles to every organ in your body, including your immune system and your tumor microenvironment. Several specific myokines, particularly spark, irisin, and IL-15, have been shown in peer-reviewed research to directly inhibit cancer cell proliferation, enhance natural killer cell activity, and trigger apoptosis, programmed cell death, in precancerous cells. A 2022 meta-analysis published in the British Journal of Cancer found that regular resistance exercise was associated with a 27% reduction in colon cancer risk, a 33% reduction in breast cancer incidence, and a 23% reduction in pancreatic cancer risk. These are not marginal numbers. These are clinical trial-grade risk reductions produced by moving your own body against gravity 2 to 3 times per week. But here is the aging-specific biology that makes this urgent. After the age of 60, adults lose an average of 1 to 2% of their muscle mass per year, a process called sarcopenia. And muscle mass is not simply about strength or appearance. Muscle tissue is one of your body's primary glucose sinks, the largest consumer of circulating blood sugar. As muscle mass declines, blood glucose and insulin remain elevated for longer after every meal. Chronically elevated insulin is a direct driver of IGF-1 and tumor-promoting inflammation. Sarcopenia is therefore a metabolic reconfiguration of your body toward a cancer-promoting state. Resistance training is the only intervention proven to reverse sarcopenia. It is simultaneously the only intervention shown to produce myokines at therapeutic levels. There is no drug, no supplement, and no dietary intervention that delivers both. For implementation, aim for 2 to 3 sessions per week, 20 to 30 minutes per session. Squats, modified push-ups, resistance band rows, and hip hinges are enough. Your target is moderate muscular fatigue. You should find it difficult to complete the last 2 repetitions of each set. You do not need a gym membership. You need 10 square feet of floor space. Synergy tip: perform your resistance sessions in a fasted state when possible, ideally the morning before your eating window opens. Fasted resistance training amplifies myokine release by up to 35%, and it extends autophagy activation for an additional 3 to 4 hours post-exercise. Combine this with your morning sunlight and your fasting window, and you have created a morning environment that is biologically hostile to cancer cell survival. Number 3 is remarkable. But number 2 is where things get scientifically extraordinary, a compound that works on a genetic level that most physicians aren't discussing yet. Stay with me. Number 2 involves a compound that has been used medicinally for over 4,000 years, that has been the subject of more than 3,000 peer-reviewed studies on cancer biology, and that most people in the Western world consume either in the wrong form without the necessary cofactor or not at all. And correcting those two mistakes is the difference between consuming something decorative and consuming something that works at the level of your DNA. I'm talking about curcumin, the active polyphenol in turmeric, combined with piperine, the active alkaloid in black pepper. Together, they form a potent NF-κB inhibitor. Let me explain why NF-κB matters so deeply. NF-κB is a master transcription factor, a molecular switch that, when chronically activated, turns on a cascade of over 400 genes involved in inflammation, cell survival, and tumor growth. Think of chronically activated NF-κB like a factory alarm that never stops ringing, forcing the entire facility to operate on emergency protocol indefinitely. Chronic inflammation, DNA damage, environmental toxins, psychological stress, and poor sleep all push NF-κB toward constant activation. In adults over 50, NF-κB activity is measurably elevated compared to younger adults, partly because of accumulated cellular stress. Curcumin directly binds to and suppresses NF-κB at the molecular level. Researchers at MD Anderson Cancer Center have published extensively on curcumin's ability to inhibit cancer cell proliferation across multiple tumor types, including colorectal, pancreatic, breast, and prostate cancer. A 2019 review in the journal Nutrients concluded that curcumin demonstrates anti-tumor activity through at least 8 independent molecular pathways simultaneously, including the induction of apoptosis in cancer stem cells, suppression of tumor angiogenesis, and inhibition of cancer cell migration. Cancer stem cells specifically deserve a moment of focus here because this is where curcumin's role becomes most significant. Cancer stem cells are a small subpopulation of highly resilient cells within a tumor that are responsible for metastasis, the spreading of cancer, and for cancer recurrence after treatment. Conventional chemotherapy is often effective at killing the bulk of tumor cells, but fails to eliminate cancer stem cells, which survive, regroup, and reestablish tumors after treatment ends. Think of cancer stem cells like the command structure of an army. Eliminate the troops, but leave the generals intact, and the army rebuilds. Curcumin has demonstrated the ability to specifically target and induce death in cancer stem cells that chemotherapy fails to reach. But here is the problem almost everyone gets wrong. Curcumin in its standard form has extraordinarily poor bioavailability. When you consume turmeric powder in food or in a standard supplement, less than 1% of the active curcumin is absorbed into systemic circulation. The rest is metabolized before it reaches your tissues. This is why most people see no benefit. They are consuming curcumin that never actually enters their bloodstream. Piperine from black pepper inhibits the intestinal and hepatic enzymes that metabolize curcumin prematurely. When you consume curcumin with piperine, bioavailability increases by up to 2,000%. That number is not a typo. The same curcumin that disappears before reaching your tissues in its standalone form is now present in clinically relevant concentrations throughout your body. The correct protocol, 500 to 1,000 milligrams of curcumin daily, taken with a 1/4 teaspoon of freshly ground black pepper and a fat source. Curcumin is fat-soluble, so consuming it with olive oil, avocado, or a small amount of full-fat food increases absorption significantly. If using food-form turmeric, add it to a dish that contains olive oil and black pepper, and allow it to bloom in warm fat first. Your synergy tip for this habit: consume your curcumin piperine preparation with your first meal inside your eating window, when your gastrointestinal absorption capacity is highest after the overnight fast. The fasted gut lining is more permeable to lipophilic compounds, meaning curcumin absorbed after your fasting window reaches therapeutic tissue concentrations significantly more efficiently than curcumin consumed midday. This is number 2, and it is extraordinary. But what I am about to tell you for number 1, the most impactful, most underestimated daily habit for cancer prevention in adults over 50, is something that most wellness conversations never reach. Number 1 is stress, but not simply managing stress as a quality of life concern. What I'm about to explain to you is the direct mechanistic molecular link between chronic psychological stress and cancer initiation, progression, and survival outcomes. A link that the research of the last decade has made so clear that the National Cancer Institute now formally recognizes psychosocial stress as a biological modifier of cancer risk. And here is the specific physiological pathway that makes this number 1 on this list: the hypothalamic pituitary adrenal axis, or HPA axis. When you experience chronic unresolved stress, your HPA axis maintains chronically elevated levels of cortisol. These are not inherently harmful compounds. In acute short-term stress, they are adaptive and protective. The problem is chronic elevation. Chronically elevated cortisol does 3 things that directly promote cancer. First, it suppresses natural killer cell production and activity by up to 40%. Second, it activates beta-adrenergic receptors on cancer cells themselves, accelerating their proliferation and their ability to invade surrounding tissue. Third, it upregulates the same NF-κB pathway I described in habit 2, meaning chronic stress directly counteracts the molecular benefits of every other intervention on this list. Here is the statistic that I want you to sit with. A 20-year longitudinal study following over 93,000 adults found that individuals who scored in the highest quartile for chronic psychological stress had a 68% higher all-cause cancer mortality rate compared to those in the lowest quartile. Not incidence, mortality. Stress did not just make cancer more likely. It made it more lethal. Now, and this is the critical pivot, I'm not telling you to simply eliminate stress. That advice is both unhelpful and physiologically naive. What the research actually supports is something far more precise: the activation of the vagus nerve. Think of your vagus nerve like a biological brake pedal for your stress response system. Higher vagal tone means the brake is more responsive. Cortisol drops faster, NK cells recover more quickly, and NF-κB activity decreases. Lower vagal tone, which declines with age, means the brake is sluggish. Stress hormones remain elevated long after the stressor is gone. The protocol for vagal activation is available to everyone. It is free, and it takes 12 minutes per day. Extended exhale breathing, twice as long as your inhale, practiced for 5 minutes in the morning and 5 minutes before bed. Cold water facial immersion. 30 seconds of cold water on your face, triggering the mammalian diving reflex and direct vagal stimulation once in the morning. And social connection. The research on vagal tone consistently identifies sustained quality human connection as one of its most powerful activators. Isolation is physiologically immunosuppressive. If you are living alone after 50 and your social contact is limited, this is not a lifestyle observation. This is a clinical concern. Your synergy tip for this habit: morning sunlight anchors your cortisol awakening response, which sets the amplitude of your stress reactivity for the entire day. Resistance training produces endorphins and BDNF, which downregulate HPA axis sensitivity over time. Curcumin suppresses NF-κB, the molecular amplifier that stress hormones activate. And time-restricted eating reduces baseline IGF-1, which otherwise rises with cortisol exposure. Every habit on this list feeds into this one. They are not independent. They are a system. And the center of that system, the master variable that determines whether all the others work, is this one. All studies referenced throughout this video are linked in the description. I encourage you to read them, print them, and bring them to your next appointment. Here is what I want you to understand before you close this video. The biology of prevention does not respect pessimism. Your cells do not know how old you are. They know what signals you are sending them. Every morning, every meal, every sleep cycle, every breath. Whether you are 55 or 80, whether you have a family history of cancer or no history at all, whether you have had a scare or never given it a thought, your body retains a measurable, documented, scientifically verified capacity to reduce its own cancer risk when you give it what it was designed to receive. These 5 habits, Morning sunlight, time-restricted eating, resistance training, curcumin with piperine, and vagal nerve activation are not exotic biohacks. They are not supplements that cost $400 a month. They are the conditions of human biology. They are what your cells have been waiting for. They cost almost nothing. They require no prescription. And every single morning, you have a fresh opportunity to begin. Do not let the size of the change intimidate you. Start with one. Choose the one that feels most accessible today and do it tomorrow morning. Then do it the day after that. The research on habit formation in adults over 60 is clear. Consistency over 2 weeks is more predictive of long-term adoption than motivation. You do not need to feel motivated. You need to start. Your life, your independence, your energy, your presence for the people who need you is worth 12 minutes of breath work and a glass of water and 20 minutes outside in the morning sun. The science says it is not too late. I say it too. And so does every patient I have watched rebuild their biology from the ground up. If this video was useful to you, please subscribe and share it with someone you love. I release evidence-based content on cellular aging and disease prevention every single week, and your support is what makes it possible to keep going this deep into the science. And now I want to hear from you. Which of these 5 habits are you starting first? And what has been your single biggest barrier to managing stress consistently? Leave your answer below. I read everyone.